Hi there, my name is Dr. Brad Deakin from Burlington Spinal Decompression. So we're going to talk about something called a slipped disc today. A slipped disc is a term that's used by professionals that don't really specialize in disc degeneration or spinal problems. It's kind of a catch basin term that means disc degeneration or a disc bulge or a disc herniation. Now, if you've got one of these, or if somebody has said you have a slip disc, most often your medical doctor, I think it's really important to try and find out what exactly is going on. So anybody that comes into our office, we do very thorough investigation of what the problem is. First and foremost, a history is really important because we can find out what kind of accidents, injuries, and traumas you had in the past that has started this degenerative process. We do two different types of nerve scans. One is an electromyography that tells us how well your brain is running all of your paraspinal muscles and the nerves. And the other one is an infrared thermography that tells us how well your autonomic nervous system is functioning. And then, of course, we do in-office digital x-rays that measure down to 1/10 of a millimeter. They're very specific, and it helps us diagnose exactly what has caused the disc issues. Now, sometimes we need to get advanced imaging like a CT or an MRI, but most often spinal problems can be diagnosed through regular digital x-rays. And we teach people how to read these incredibly well because we want you to have what's called informed consent. You have to see what's going on, but more importantly, understand it. That's how you make an informed decision of what you should do with it afterwards. So just to recap, a slip disc is kind of a process or a catch basin term that basically means you have degenerative processes that are continuing. It usually moves from disc degeneration to a disc bulge, which is sometimes called the slip disc, and then it moves into a herniation, which is more severe, and then it can go into what's called an extruded disc, a prolapsed disc, or a sequestered disc. So that's when they get a little bit more severe. They always cause problems in the future if you don't look after them now. And we've always found that if you're going on a road that's going in the wrong direction, unless you do a stop and a U-turn, you're going to end up in the wrong place. We can help you. My name is Dr. Brad Deakin. We're at Burlington Spinal Decompression. Please give us a call. Thank you.